This week, on Friday, March 22nd, we celebrate World Water Day. We live in a world with a global water crisis. And if you're listening to this podcast, you are most likely living in a world where you can drink from the tap. But for over 700 million people, this is far from possible. Over 700 million people live without access to clean drinking water. Unsafe water and lack of basic sanitation causes more deaths each year than all forms of violence. This includes victims of war, and children are especially vulnerable. Their weakened immune system cannot withstand intense dehydration from diarrheal diseases. So today's episode tells the story of a man who stumbled across his passion for clean water when he visited a young boy named Bryan in El Salvador, whom he and his wife sponsored. He realized that the one thing holding Bryan back from fulfilling his potential was access to clean water. And from that moment on, his life changed. So before we dive in, here's a little bit about our guest today. Sean Kappauf is an inspiring and visionary leader who serves as an executive director and founder of One ATTA Time. Drawing on over 15 years of experience in the nonprofit sector, Sean has honed his skills as a seasoned public communicator and possesses a deep passion for connecting people to the global water crisis. Through his strategic guidance and unwavering commitment, One ATTA Time has made a remarkable impact worldwide, providing thousands of families with access to clean water, thanks to the efforts of local leaders and the generosity of supporters. My name is Hetal Bahman, and this is the Global Health Pursuit. Thank you so much for coming onto the podcast, Sean. I'm really excited, and I just want to say, shout out to Kayla Williams. She introduced me to you and also introduced me to Extra Mile Pediatrics. So she's been, doing some real outreach work for you guys.
She's in Guatemala as we speak with our team and Extramural Pediatrics. Pretty cool.
Yeah, no, I've been following her stories and just it looks so amazing down there.
Yeah.
Amazing. So hey, we're going to be talking about One ATTA Time, and something that I really like to talk about in the very beginning of my episodes are really just like the story of how this nonprofit came to be, because a lot of times the founder's journey is always so fascinating to me. I'm sure you've heard of this podcast by Guy Raz. It's the How I Built This podcast. And I listen to that podcast like religiously, and I just love that beginner's story. So could you just tell us your story, Sean?
Yeah. The nonprofit started in 2013, and I was working at a church in Costa Mesa, and I was in a space where I just didn't care anymore. And when you work in like a religious institution of some sort, usually there's, I guess, different reasons why you would be a part of that. But for me, it was because I wanted to care for people, and I like people, and I wanted to share my faith with them and on their journey and hear where they're coming from, so on and so forth. And I came to a place it was probably about 8 years into this whole thing, and I just felt like I had apathy. I could care less. And so I just started doing some like internal work of like, why do I not care anymore? Should I just quit this and do something else? Or
when you say I didn't care anymore, what do you mean by that?
I didn't care about people.
Didn't care about.
I didn't care about my job. I didn't care about the people. People would come up to me and they'd be like, "Hey, could you pray for me?" And I'd be like, in my mind, I'm like, no, I don't want to do that. And then I would just say some like anemic prayer of some sort and just move on my way. I just felt like, man, what the heck happened to my heart? Like, what happened to caring? How did I get to this space in this moment in 2013 to where I could just care less about people, care less about what I was doing, and just completely kind of just burnt out. And I just like, I'm like, you know what? I got to like do some self-reflection, internal work, what is going on inside my own heart, and then how do I make that care again? And so I just started thinking like, what do I prioritize in my life? In other words, like, what do I like to do? And what
Mhm.
gives me life is another way of saying it. And I remember thinking, I'm like, well, I love to surf. I don't know what I can do with that. I love coffee, maybe just because of the caffeine, or the
Yeah.
jolt that it gives me. And I also love kids. I love hanging out with kids. And I remember thinking, it reminded me of the movie Monsters Inc. And in the
Mm.
spoiler alert, if you haven't watched it, but you should watch it because it's good.
It came out a long
I
time
know. I
ago.
feel like
I'm
if you
pretty sure.
haven't seen it yet, dude, get a grip, man. No. But the premise of the movie is that the monsters come out of the closets and scare the children at night, and the screams energize these like energy tanks that then energize the monster city. And so that's why,
Mhm.
monsters scare kids at night under the bed or whatever. And whoever's the best scarer, wins all these, awards and stuff. And
Right.
at the end of the movie, they realize that, wait a second, if we make the kids laugh, it's like 100 times greater. More energy comes from making them laugh. And I felt like that's
Mhm.
so true for kids. Like if we're hanging out and there's kid laughing, like if we're getting coffee or something and there's a kid running around laughing, it just changes the entire atmosphere. At least for me, it gives me life where I'm like, oh, that childlike laughter, that childlike wonder, that there's the world is just
It's
as
like, where did we lose that
yeah,
too? It's like
yeah.
where,
There's this big
right.
mystery, this whole thing, this whole world. They're not inundated by all these things that get pushed onto us as we get older, and
Right.
all these other, elements that come into our life where we lose sight of that childlike wonder. And so I started thinking, I'm like, you know what? Maybe I could do something to help kids. Maybe that will give me life in this space where I just feel like
Mhm.
I'm dead inside. And so I started to research, and I don't know why I did this, but I just started researching what's taking away life from kids. And maybe I can be part of something that gives them life again. And that's when I
Mhm.
discovered that water related illnesses are the leading cause of death globally for children who are 5 and under, meaning that children who
Mhm.
are 5 and under are dying from diarrhea, essentially, bacterial infections, parasites, all
Got
from their
it.
drinking water. And that shook me because where I live in Southern California, I didn't know that. I had no idea. I've never once thought that my water could potentially hurt me. I've never once thought that my water could potentially hurt kids that we drink from. I never, it's never crossed my mind because we live in an environment where that problem has been, for the most part, solved, at least for my childhood. And so I started thinking, I'm like, well, shoot, maybe I can do something to provide kids clean water. I don't know anyone who suffers from that. I was newly married about 2 years in at that time. So my wife and I, we didn't have kids yet. And I just remember thinking, I'm like, well, I'm just gonna like throw it out to the universe and just kind of like, there you go. If something happens, so be it. If God wants to do something there,
Right.
so be it. Whatever that is, I don't know. And I remember walking downstairs and opening up my fridge. And when I opened up the fridge, there was a little magnet on the fridge. And it was a little 3-year-old boy named Bryan that my wife and I sponsored through another nonprofit. And the sponsorship gave him, help pay for his education and help pay for, just basic stuff that he didn't have access to. And so we supported him on a monthly basis to have access to education. And I'm like, hey, I kind of know a kid. We give that kid money. Like maybe I
Right.
can start there. I don't know what his situation is. I don't know anything about him other than the little letters that he sends us, through the organization. And so I just told my wife, I said, hey, I'm going to go down to El Salvador and I'm going to meet that kid on the magnet. And she's like, really? I'm like, yeah, why not? And so fast forward,
It's like so unheard
I
of. It's
was like,
like
I don't know. That's just kind of, I just shoot by the hip. I am somewhat of a planner, but I kind of just like when I see something, I just go for it, and that's just kind of
right.
part of who I am.
Yeah.
And so fast forward 6 months. Well, actually, pause. In that space, when I found Bryan and realized I know someone, I was like, you know what? Cool. I got someone. I'm gonna go down to El Salvador. In the meantime, I'm just gonna create a basically a blueprint of a business. And so I created the nonprofit, the idea of a nonprofit, not wanting to start one just because I was bored and this was giving me life. And I was like, well, if this is what gives me life, I'm just going to go into like, what does it look like to start a nonprofit? What would my mission be? What would my values be? How would I structure it? And what would it look like? And what would the name be?
Hmm.
Could I brand it? What are the parts that I would use? I didn't know anything. And so all I just said was like, well, I know there's a lot of kids out there that don't have access to clean water. And I know I can't help them all, but what if I can just help one at a time? And there's that Mother Teresa quote where, and I might butcher it, but the idea is that if you can't feed one, I can't feed 100 and just feed one. And I'm like, well, if I can't give clean water to 100, but I can at least give it to one. And so that's kind of where the nonprofit One at a Time came from. And so in that space, as I'm kind of marinating in this idea, this vision, it's kind of just sitting there. I find myself in El Salvador in August of 2013, and I'm standing in this community. It's about 40 minutes inland of San Salvador, the capital there in El Salvador. And as I'm standing there, a bunch of kids are running around, and all of a sudden I hear this Chon, Chon, and I'm like, oh, who's that? And I look up and there's this like little dirt hill that's going up this way, and I hear this Chon, Chon, and it's this little kid running down the dirt hill. And as it gets closer and my eyes kind of focus in, and I'm like,
Mm.
hey, that's the kid under my magnet. That's Bryan. And he's saying, hola, Chon. My name is Sean, but he's like, Chon, hola, Chon,
Yeah,
hola,
yeah.
Chon. And he runs up, this little 3-year-old kid, cute as can be, grabs my leg, bear hugs it, and then looks up at me and goes, hola, Chon. It was like electricity coming up through my leg into my heart. I didn't have kids at the
Yeah.
time, so I didn't know what that really felt like, but it was like, oh my goodness. It was like immediately that like Monsters Inc. kind of life energy source
Yeah.
was energizing my body and into my heart. And so I picked him up and he was so happy to see me. And the whole time I'm thinking, how the heck does this kid know who I am? Like, what?
Yeah.
Does he have a magnet on his fridge? Does he even have a fridge? Like, I'm like, all these questions go through my
Right,
mind. So
right.
he's showing me inside of his house, and sure enough, there is a picture of my wife and I in his little corner of the room. And I'm like, how did he get that? And then he's showing me all these letters that we've been writing him. It's signed Love, Sean, and Kelsey, my wife. And I'm like, I didn't write those letters. And I'm like, oh, that's my wife's penmanship. Oh, my wife has been
Mm.
communicating to him on a monthly basis. No wonder he knows who we are. No wonder he has a picture of us. It's no longer creepy. Now it makes sense, you
Mm.
know? And the mystery has been solved. But as I'm standing there, I'm asking his mom, how's the sponsorship? Is it working? Do you like it? And she's like, yeah, thank you so much. He loves going to school. He loved learning and coloring and drawing and all those things. I'm like, ah, wonderful. And I said, well, how's his health? And she's like, well, actually, he's sick. And I'm like, what do you mean? What does he have? He has worms. I'm like, worms? From what? And she's like, from our drinking water. And then I'm like, oh my
Yeah.
gosh. And it was in
Mhm.
that moment where I felt this tug of like, I got to do something about that. And so that after meeting him, that led me on a journey of trying to figure out what's the best medium to treat his water. And I found this nonprofit that was providing clean water. And so I purchased one of their filters. I realized that they didn't manufacture the filter. They just put their sticker in the bag and,
Mhm.
which is fine. But when I bought it, I was like, oh, this is not from them. So I contacted the company that manufactures the filter.
The
Yeah. So that
Mhm.
company is called Sawyer, and they're based in Safety Harbor, which is basically Tampa. And so I called them and I said, hey, these filters look like they would work really well in the community that I know of someone who needs clean water. Do you have any nonprofits that work in El Salvador? And they said, yeah, we have like 5 or 6. And I said, can I have their email, phone number, any way to contact them? They said, no problem. So they sent me all the contacts for them. And so I just immediately started emailing them and calling them. And nobody called me back for at least a week. And then I reached out again, second week, nobody. And that's when I just came to the realization of like, well, if it's not you, then who? I was like, I'm just going to do it. I was hesitant to do that because I didn't want to start a nonprofit. I just want to partner with someone who's already doing it. Like, I don't need to recreate the wheel
Yeah.
here. Like, there's plenty of these people
Right.
out here, but no one called me back. And so I just started. That's when my business plan early on came back into, focus. And I just started thinking, well, if I do this, I have a product, I can afford 50 filters on my own. I don't really need to start a nonprofit. Maybe I just put the nonprofit to the side, get a group of people together from the States. We go down there and figure out how to distribute these filters. And so I contacted a couple of buddies of mine who've been working in El Salvador for a number of years. And I just asked them, hey, I have this product. I have a kid who needs clean water. I feel like this solution would work if it's done well. How do I make sure my help doesn't hurt someone? How do I make sure I go down there
Huge
and
question.
not be like a white savior or or feel
Right.
like, look at me and all my good stuff. Let me take a selfie with you.
But here's my question.
Yeah.
But here's my question to you, Sean. Like, I mean, I feel like a lot of people wouldn't have thought of asking that question, right? It's like, I feel like
Yeah.
most people would have been like, okay, let me just give it, like, instead of really digging deep and being like, wait, am I hurting them by doing this?
Yeah.
What am I,
So,
you know what I'm
yeah,
saying? Like, what prompted you to really think about that?
two things. One, my own personal experience and being dissatisfied with it and doing intercultural work and seeing it going and feeling just like, oh no, this doesn't feel right. And then the other thing was like, me seeing a magnet and just going to El Salvador. I shoot by the hip a lot to my betterment and my detriment. And,
Right.
and when I first found out about this filter, I was in El Salvador. I researched the filter immediately when I got back to my hotel in San Salvador. And one of the leaders on that trip, I started telling him like, dude, I can get this filter down here tomorrow. It's going to cost, I can at least get one. I'm going to expedite it. I can get here tomorrow. We can clean water. I said, no. Don't do that. You want to make sure, Sean, your help doesn't hurt. And I'm like, you're right. So twofold, my own personal experience, but great leaders that I was surrounded by that have known how to do, a similar type of humanitarian work were able to kind of link together with me and show me years of experience and years of failure on their side. And then just kind of, bequeathing it to me and giving me the insight, those golden nuggets, so to speak, so that we start off on the right foot or the best foot that we could possibly start on, not knowing any of the other variables that may exist. And so that's kind of where it came to is I just had great people around me and my own personal experience and hesitancy to try to
just impulsively act.
There is an impulsive nature to me, but there also is a hesitancy of wanting to make sure that what we do is ethical, wanting to make sure that what we do is it gives dignity and honor to the people that we're partnering with. And it still is today a part of everything that we're doing. And it's been neat to hear other people's vantage points and perspectives on that so that we can continue to do the best we can with what we know, also knowing that we're always learning and have blind spots along the way. That doesn't hesitate us to keep trying. But when we do screw up, we always are quick to learn from it and be like, damn it. That didn't help.
Right.
That was not great. Let's apologize and let's move forward, But for the most part, we don't have too many of those. And so that's kind of how I started it. And so I talked to some of the local friends that I have down there, and they said, Sean, I think the best way to do this is to reach out to the local leaders of that community. So when you get down there, get to know them, let them get to know you, tell them your intention and your heart behind it, show them how that filter works, show them how to maintain it, and then let them be the ones to figure out how to distribute it. And he said, and then on top of that, you don't want to make sure that you don't just give it and leave. So create up some sort of follow-up system with them. Continue to build the relationship with those leaders, letting them know that, hey, I'm not just here to this is not just a one-stop shop. I'm here to be here as long as you want me here. And so that's what I did. We brought a group of people down in February of 2014. I made relationships with the local leaders. The relationships were actually a little bit expedited because some of the people already had years of relationships with those leaders that I brought with me. So I was able to kind of step on their shoulders, and so to speak, even though they didn't really know me, they knew them. And so when I brought them in, it was easier to distribute in a quicker fashion. And they decided to train some young leaders to go out to each of the houses in Bryan's community. So there's 50 families there. And they distributed the filters on their own. No white person, no gringos going there and doing it. We were there, but they weren't the ones educating. They weren't having to translate for us, none of that stuff. We're just there to watch. and Bryan got access to clean water. And you fast forward to today, and I still see Bryan. I try to see him once or twice a year, but I still see him. And he's 13 now. And you know what? I think he just turned 14 in September. So I think he's 14 now. I get the numbers mixed up. But anyways, he's a teenager. He's no longer a cute little kid. Let's just say that.
I don't even know how old I am at this point.
Same here. It's like I lose track. I'm like, am I 40 yet? I feel like it. I have gray hair. I look like I'm 50. But anyways, we went in there and they did it and it was successful. And we followed up and they were using it and continued to use it. And so I thought like, oh, my job's done. And then the leaders asked, hey, there's 190 more families in the area and they want the filters. And then I thought, well, I was like, I don't have that money. I can't do that. And so I just told him, said, look, give me 6 months. So I gave him a date. I'm going to contact you by that date. I cannot promise you anything, but I will try to raise money for 190 filters. And if I can do that, I will let you know and we'll come down there and do it. But there's no promises. I can't promise you anything.
And how much, approximately how much was each filter?
About $50 was what it cost, door to door, basically, and purchasing it and delivering it. At the time, it was about $50. And I'm not, even though I live in Southern California, I don't have a lot of money. And so I'm like, I got to figure that out. So that's when I went back home, I was like, okay, what is a 501c3? What does a nonprofit organization look like? How do I set that up?
Probably Googling that.
Yeah.
Like, how to start nonprofit.
Exactly. I just started calling people who have one and said, how did you start it? Like, what did you do? Mm-hmm. And this one lady said, I used an attorney because I didn't want to screw it up. And I'm like, that sounds great. And so I just found a guy who starts nonprofits as an attorney. And then I asked one of my buddies, could you pay for this guy to help set this up? And he said, absolutely. And I said, once it's set up, it's retroactive to the date that I got my EIN number. So your donation will still count. And he's like, Sean, I don't care. And I'm like, I'll just give you the money. I'm like, okay, great. Sounds wonderful. And so we started the nonprofit with a small board of about 5 people and then guns a-blazing. And then from there, I just kept saying yes to a lot of things. I was still working at the church. It was never a paid gig in the nonprofit until 2018, in August of 2018, when I decided to step off working in the church and then running the nonprofit full time and kind of just risking it all with my family. I had 2 kids and my wife still, I mean, we're still married.
Good to know.
Yeah, hey, it's great. Like 13 years or something like that. It's wonderful. But I just launched out into nothing. There was no money to pay me, but I felt like I need to go all in on this because it's just kind of, I never wanted it to succeed. I just wanted to give Bryan clean water, but people kept wanting it and it kept working. And I just kept doing it on the side and traveling, every quarter to Vietnam or to El Salvador and to the other locations or certain areas that would say yes, I'd go there and it just kept working. And I'm like, shoot, I should probably just do this full time. And there's a whole other story on that side of things, but I ended up just launching into it. And you fast forward to today, and we're in 8 countries, and we provided, at least right now, about 50,000 families access to clean drinking water, which is pretty awesome to think about as I look back.
Wow.
It's like I've given one, person clean water, but then we just got more people to be engaged. And as more people are engaged, and we just focus on that one, we keep that same in our organization. I tell our staff, I tell everyone, I say, as far as we want to go wide and reach lots of people for clean water because they need it, we need to have that same level of depth and care for one. So that's our rate of speed that we travel in this organization. I do not want to just blow things up and give it, we're going to give 1 million people clean water this year. I want to go at the rate that I think we can handle based upon the team that we have and the care that we can give, because every child matters and every family matters and every community matters to someone and also to us. And so for us, that's kind of the rate at which we've gone. And we're able to now like maximize on a whole nother level just because of the volunteers and the leaders that we have in the organization. So yeah, that's kind of how we started. There's a it's like in my mind, it's like very smooth. And then in reality, it's like going back here, up here, this way.
Oh yeah, of course.
Like, what the heck?
I mean, I feel like everybody's seen that meme where it's
Yeah,
like the squiggly
it is.
line going down and then up.
It is
Yeah.
so true. So many calls. Like, and I remember, like, man, 2020, it's going to be like, we've got vision. We're going to see things clearly. And then no one would have anticipated. And you're just like, the heck happened? Yeah, it just completely shifted.
I remember.
Yeah.
Yeah. I mean, I was working my engineering job at that time, and I just remember my manager coming over to me and being like, "Yeah, just pack your stuff and bring your laptop home. We don't know when you're coming back."
Yeah. Yeah. I learned the great lesson of pivoting. And so we pivoted a lot in just trying to figure out creative ways to continue help while being locked down. So that was fun.
Oh my gosh. So my question, I think it's interesting that you said that people just wanted more,
Yeah.
right? They wanted filters for more
Mhm.
families and all of that. How did that outreach work? Did people just find out about you and say, "Oh,
Yeah.
like in
hmm
Vietnam and all these other countries, how did that
Yeah.
was it word
It's
of
word of mouth. Yeah. I've never, like, people ask, like, oh, how do you know which countries to partner with? I have no idea. I don't. They come to me. They just show up.
right?
And it's hard there's no, like, magic sauce behind that. There's no, like, I think because of the position that I had at the church and churches that I was working at over the course of that beginning stage of the organization, I was communicating to a lot of people from a stage. And I wouldn't necessarily proselytize the nonprofit, but there was a captive audience listening to me share about my experience over here in El Salvador. And people in the audience would come up afterwards. And for example, for Vietnam, I was sharing about my trip, and someone from Vietnam was there who's a part of an
Mhm.
organization and that helps orphan children and children that are in need. And she's like, oh my goodness. And she's Vietnamese, and she's like, we need this in Vietnam. Could you come to Vietnam? And I'm like, yeah, I can. I have a passport. We can do
Okay.
that. When do I go? And she's like, when can you go? And I'm like, whenever you want. I don't know. We'll figure it out. And so I went to Vietnam on a scouting mission and also Cambodia. And we did small little pilot projects, and it worked. And we continued that relationship. And there have been other locations where people have reached out and said, hey, can we do it here? And I'd say yes. And over time, I had to limit my yeses based upon certain criteria of what we would think would work over the long haul.
Mhm.
And essentially it got boiled down to just two criteria for us partnering, because we get people asking all the time. And right now we can't really it's just really hard to expand into other countries without two things: money, funding,
Mhm.
and the right leadership that would work, that would work in a partnership. Sometimes people just want you to give them money and they're going to do their own thing. And I get that. And that is one way to do it. But I like relationships. My whole organization is based on that. Like, I want to get to know you and you to know me. I'm not an ATM. I'm a person. I want to hang out. So sometimes, people, they will see you as an ATM and just a resource, and that's fine. But that's not how our organization works. We really want to get to know people. And in that process of getting to know people, we really want to connect with leaders with basically two criteria: that you're kind and that you're competent. And so we're looking for people that the rest of the community loves and adores because they know that they're kind. But we're also looking for people who can actually do the work. And what I've realized over the years of just saying yes to certain people and certain leadership and certain organizations is that they're either really kind, but they don't do anything, or they're really competent and they're jerks. They burn bridges, and they, like,
Mhm.
take the bull by the horns, and they go out there and they're like just destroying everything. And you're like, no,
Oh gosh.
how can I find someone who's kind and yet wants to do the work? And so the countries that we're in now and continue to invest in, we've found incredible local leaders that are both kind and competent. And that works for us. And they want relationships. They care about the people, and they care about people that are the most in need. And that's really essential for us too, is like, everyone in these areas needs access to water, but a lot of them can afford it. They can pay for it. There are some people, though, that can't. And those are the ones we want to start with first. We want to start with the families who can't afford water that have children 5 and under. That's our, like, if we're going to triage a location and start a pilot project in a new country or a new area, that's what we're targeting first because they're the ones in most need. And then we'll move out from there. And that's kind of been our basis. And we're looking for those leaders who are willing to do that and go above and beyond their idea of who needs it, their friends or that person, but really the people who need it most. And so the countries that we work in now, we've found those types of leaders and it's worked really well. And the relationship continued to blossom because of those locations. And so when it comes to like how we ended up in those countries, it's really just by word of mouth. And word spreads pretty quickly. And the world gets a lot smaller once they find out about what you're doing. Yeah. I mean, we work in an area called La Mosquitia. This is the weirdest one, probably. We, we work in an area in La Mosquitia, which is it's basically like its own nation within Honduras. And there's about roughly 100 tribal indigenous communities in this like jungle, basically. Very hard to get to, very remote, and they need a lot of help. And our director in Honduras was at a coffee shop and he was sitting there talking to one of his volunteers about a distribution that they had planned for next week and where they were going with clean water. And this random guy was sitting next to him, overhearing it, eavesdropping in on it. And he's like, "Excuse me, I'm sorry, but what are you guys doing?" And he's like, "Oh, well, we're providing clean water." And he's like, he kind of eavesdropped in and he said, "What are you guys talking about giving clean water to people who are in need?" And he's like, "Yeah." And he's like, "I work in an area called La Mosquitia and they really need access to clean water." And my director's like, "Well, why don't I set up a meeting with my bosses and we could start a conversation?" And he's like, "That would be wonderful." And so he reached out to us and then we had a meet, and we get these meetings all the time. And so I'm sitting in the meeting listening to him and I'm like, man, we should entertain that idea. And fast forward to today, and we are providing tons of families access to clean drinking water in La Mosquitia through another organization in the US that has been helping fund it. And we're continuing to expand even to this day, like even on a larger scale, because we've only gone to a few communities, but our goal is to get to all the communities in La Mosquitia just by a random guy eavesdropping in a conversation in a coffee shop. It's like you can't script it. You just got to get out there and do it. And that kind of magic, that kind of serendipitous moments begin to just naturally show up.
Wow. I feel like, a lot of this stuff is just like the universe placing
Uh-huh.
people like
Totally.
in around your area and then just things happen.
They really do. And I think when you're in like the planning stages and you're thinking like, okay, well, and you have all these strategies and you have all these marketing ideas and all these things and all those,
Plans and
all
all
that's
yeah.
good and helpful. But at the end of the day, you're not going to see anything happen unless you just get out there and start doing something. And when you start doing something, that's when you begin to see the ball rolling and you get to experience these really cool interactions and things. You're like, how the heck did I get here? It's awesome. I love it. Some people, it causes a lot of anxiety because there's a lot of mystery behind that. There's not like a footpath that you can follow. You just kind of like gotta blaze your own trail almost and move forward. But I enjoyed it. I enjoy it now.
I know. I mean, obviously, just talking to you, there's a light, but like, you just light up when you talk about this. And I'm sure when you think about how you were feeling before you started the nonprofit and, just not caring, it's just, there's like a stark difference there.
Yeah, it bred from apathy to action, essentially. And I think that's a human condition that we all experience once or twice or many times in our lives. It's just feeling a state of apathy and what do I do to reinvigorate that space in my heart to care again? And sometimes we just get caught in the mundane things of life. Like our life just seems like the same every day. It's like Groundhog Day and just wake up, same thing all over again.
Yeah.
And I would suggest shake it up, quit your job. It sounds irresponsible. Probably is. But so is just sitting in a cubicle doing nothing if it doesn't give you life. Like, what is the point? You only have so much time. Stop it.
you're preaching to the choir, man. Like, I mean, I get it. I mean, I quit my job 2 years ago. I'm still trying to figure it
Me
out.
too.
So,
Me
I
too, to be
mean,
honest. I
there you
don't
go.
know. I'm just going with it.
I want to talk about the sustainability
Yeah.
aspect of this because, you're saying you're bringing a family a filter and then you're also following up with
Yeah.
them. And you talked about this, I think when we talked before, this technology called GIS
Yep.
technology, and then implementing the community leaders within this
Yep.
process. What is GIS and how does that
Okay.
work?
Yeah. The idea behind sustainability stems from just my own personal like experience of not wanting to give something and leaving. Like that whole saying, like, feed a man a fish, teach a man a fish kind of idea, right? And
Mhm.
so it's how do we create behavior change to someone who handles water? And it constantly changes and fluctuates. We have to run based off of principles, not a blueprint. And a blueprint says it works the same way everywhere. But for us, it's
Mhm.
a series of principles, and those principles can fluctuate depending on that tribe, depending on that indigenous community, depending on that, that culture, that area, that space. I mean, one side of the river could be this way, the other side could be that way. There's so many different variables that exist within sustainability in trying to answer that question of how do we make sure that they continue to use this product over and over and over again. And then how do you track that? How do you figure out a way to ensure that they're continuing to use it
Yeah.
and not just like, well, they told me. They told me. They told me they did it. And for years, it was that. It was just we'd follow up and they would say, yeah, we're using it. And with no personal interaction. And to be honest, sometimes it's really hard to get to these locations and it costs a lot to get to those locations. And so, how do we keep that face to face personal interaction in a way that makes sense for everyone? And so, different locations and different places, depending on the proximity and all that, we try to have at least 3 touch points a year with the people that we've distributed to. Sometimes we can do that quicker than normal. Other times it takes a little bit longer than it should, but we try to do 3 touch points. And the way to monitor that, the way for us to grow, the way for us to expand wider and keep that same depth, we had to figure out some sort of technology that would allow us to do that in a way that was organized, made sense, and gave us better data behind what we were doing. And that's when we discovered GIS. I am a novice at best.
GIS technology. I looked it up. It's called Geographic Information Systems. Computer-based tool used to store, visualize, analyze, and interpret geographic
Yeah.
data.
So COVID, for example, when we were hearing about, there's a spike in COVID in Michigan. We knew that to
Mhm.
be possible because there's scientists that test the wastewater. It's the
Right.
same way they know what drug usage is going. So the moment you flush your toilet and it goes out of that pipe, that becomes public information. And they use
Mhm.
that in the water treatment facilities to analyze to see, what are the drugs being used in that community? What should we be aware of? Or what viruses are spiking? Flu viruses, cold, RSV, COVID, all that stuff is done through scientists and wastewater. The only reason why I know that is because in this process of figuring out GIS, we came across a group of scientists called Acora, and that is their job is to analyze wastewater. They're also professors at universities, but they created this own other business to help, in that process because they're microbiologists, physical chemists, and so on and so forth. And so we got linked into a partnership with Vera Bradley in Indiana. And I'm from Southern California, and anyone from Indiana or Vera Bradley in corporate would know that, yeah, we don't have a presence there. And I show up because they wanted to provide 1,100 factory workers access to clean drinking water in one of their factories out just outside of Phnom Penh in Cambodia. And so I showed them the product that we
Mhm.
have, and they said that this is perfect for what we're trying to do. And in that process of partnering with Sawyer, the filter company, and our organization, and wanting to see what we can do to link up, and so to Sawyer's thing is like, hey, we want to show that this actually can work in the factories. Would you be willing to bring along this team of scientists that we've used in the past And that's when I met these guys from Akora. And when we started implementing GIS technology of being able to geographically track it with series of questions and things that we could ask the people that we're giving those filters to. And that was really the kind of the birthing process of us using GIS to figure it out and meeting the scientific group. And essentially what we do now in all the communities that we go to is we use an app called MWater, which is really, there's a bunch of companies that use GIS around the world for different things. And MWater happens to be one that's really just more boutique and specifically honed in on water. And so when we brought that company on, it was just more simple to use because they're really just, their customer service and everything is really geared towards the idea of water. And our scientists, our team, our local leaders in Cambodia were able to figure out the right questions to ask the community. There's a bunch of things behind that. I mean, first and foremost, the person has to give consent that we can collect any form of data. So making sure that we're clear on every person that we give a filter to, saying, hey, this filter is yours, but we were wondering if we can ask a few questions. These questions are just specifically about your health and how you use your water. Are you okay with that? And most 99% say, yeah, that's fine. And to be honest, sometimes it's the first time anyone's ever asked for their consent, which is, I mean, surprising, but also not surprising. And they're always kind of taken aback, like, what are you talking about? Of course. And I'm like, no, like,
you're not just going to do it.
This is your personal information. We're going to ask you some personal questions. And if along the way you feel uncomfortable with that question, you don't have to answer it. And so sometimes our leaders that we train will have to give them agency because we'll notice them withdraw back saying, hey, you don't have to answer that question if you don't want to. Remember, like, just because you gave consent at the beginning doesn't mean that you don't still have it. You don't have to answer all the questions, which is actually kind of a neat experience to see happen. It doesn't happen very often, but to see them experience that kind of agency, which is kind of cool. But so we ask those questions, and they're usually like general, unless it's really specific on a specific project, like Bear Bradley's was more specific. We still ask various questions like, where do you get your water? Where's your water source coming from? Is it a well? Is it a creek?
Yeah.
Have you been sick in the past 2 weeks from water? If so, what were your symptoms? Headache, diarrhea, vomiting, nausea, skin rash, coughing, fever, all those things. If you do spend money on your water a month, what does that cost? If you do spend money on antibiotics or antiparasitics or going to the doctor, what does that cost? And all those questions. And all those questions are then tracked through that app through GIS. It pinpoints the location of where we took the distribution, and we do that through scanning the filter. There's a barcode on the filter that we provide. The app scans that and it collects that data there. All that data then goes back into our system that's encrypted and kept there privately. And when we follow up, our leaders would get, this week, here's the location of where we did distributions in the past 2 to 4 weeks. Go back and meet up with them. And so they get a little downline of where they need to go, where they need to follow up. And then they ask the same exact questions. And the reason we ask the same exact questions is to see if there's any improvement within the first 2 to 4 weeks. And what we notice most of the time is that on average, 33% of them have had some sort of illness due to water. So let's say diarrhea. Diarrhea rate was at 33% with the 100% of people that we interviewed. It drops to about less than 5% on average. So we see a dramatic decline, meaning that the filter or clean water is working. If they are spending money, they're no longer spending money on their water. And some people have asked, well, aren't you taking out water companies' businesses? Well, we've tested all the water sources usually in the area. We'll test the bottled water sources that they're buying, and usually they're already contaminated. So it's not even clean. I have no problem.
Oh, what?
Yeah, I have no problem taking, them not buying, having to pay half of their salary essentially sometimes because they don't make a lot on contaminated bottled water. Plus, it's extra plastic. And it creates more trash. And so, yeah, it's very common.
I've actually heard in some places there are, like, for example, in India, sometimes these kids will take empty bottled water, like, water bottles, and then fill them up and then like seal them and all that stuff and then sell them again.
Very common.
And it's just like, wow.
And that's the thing about water is that when you think about dirty water, it doesn't necessarily have to be physically brown. It can be clear,
Right.
like bacteria you cannot see, like it's you can't see it. So it looks clean, but it's not. And so we try to test all the water sources of where those places are before we actually do distribution, just to make sure that the filter will work in those areas in their water sources. But basically, all that data comes along, and we're able to see if the filter is working or is not. And what we've seen is if we follow up within the first 2 to 4 weeks, it's about a 98% retention rate that they continue to use it indefinitely. The first touch point is really important. If we do not follow up within that, if we can't, or there's some limiting factor towards that, and say we show up 3 months or 6 months later, about half are using it and half aren't. And then again, once we show up though, and we retrain them how to use it, it's a 98% retention rate on average. And so that kind of gives us a scale of how we can create sustainability through technology so that we can continue to expand, through our scientists who help us ask questions that are appropriate, to help us ask questions that will help and not hurt, to continue to figure out ways to do it that gives them dignity and value when we ask those questions, and training our leaders on how to ask questions. And it's hard because it's cross-cultural and language, there's language barriers to the point where it's like in some locations, specifically in countries where there was martial law put in place due to COVID, meaning that they were locked in their houses and they couldn't leave their house unless it was a certain period of time once a week to get basic necessities. Otherwise, you're stuck inside your house. Well, now that everything is opened back up, when we start asking questions about their health, they freeze or they lie. Why? Because they're afraid that if someone else overhears them saying that, they have shortness of breath or whatever the symptom is, that they may have COVID, and they may have this PTSD, so to speak, of like, they're going to shun me from my community and I won't be able to work for a couple of weeks, right? We didn't
Right.
realize that was happening because we have these certain communities in certain countries are like, why are they lying to us? And then we realized, oh my goodness, it's because we're taking these surveys out in public and everyone else can kind of overhear. So then we switched up how we did it and made it more intimate, more closed, and let them know, like, we don't work for the government. We're not going to be shutting you down. We just want to know because this will help us help you so that we can continue to have, you can continue to have access to clean water. The maintenance process is easy for us, but giving it to someone who's never used it before, it's new. It's a new way of using your water. We just want to ensure that you continue to have it. So there's different pivots, and our scientists are really good about that stuff and really good about helping us brainstorm different ways of implementing it so that sustainability can continue to happen no matter where we work.
I just love that you're implementing like science in the work that you're doing too.
Yeah, it's really about water. So
it's so important. Yeah. Wow. So you touched on your amazing partnership with Vera Bradley. Did they reach out to you to ask you about this, or what? How did that partnership come about?
A friend of mine, Ben, knows the executive team there. And I don't know how he had a meeting with them or something. I don't know how it happened, but they said, hey, we want to do a water project for our staff in Cambodia. And they said, we're thinking about this company, this company, this company. Is like, hey, if you want someone more personal, someone who isn't just going to go in there and then leave, but like really care, like, you should call my buddy Sean. And they're like, okay. And so they reached out to me and they said, hey, we're going to, Ben told us to contact you. We'd love to have conversations. So we just started having conversations on how we work. And I guess they were looking at a bunch of organizations. They boiled it down to 2 organizations, mine and another one, I guess. And apparently we were competing. I'm not really in competition, but I will tell you, we do a great job. So I don't know. If they lose, I don't know. I mean, whatever.
They're still getting the water.
No, everyone's
right?
getting water. It's fine. So. Like that person wants to come in, or they want, that other person to come in, not me. Fine. Just as long as they get clean water. That's all I care about. I flew out there and spoke to their executive team and some of their staff, and I led them through like a filter experience that we put people through. So companies or faith-based organizations or schools, when they partner with us, we can put just an experience together where I'll come in or someone else will come in and we'll share about the global water crisis. We'll share about our solution, and then we'll share about how they can be a part of it. And essentially, we bring all the filters that come in these bags, and they're able to piece the filters together because it comes in parts, and you piece it all together.
Mm-hmm.
You can't put the whole thing together because it has to attach to like a 5-gallon bucket, but all the steps up into that point. And then we put this little sticker that we created called a love note. And the love note basically is a white sticker with a black line through it. And on the top part, they write a love note, like you're loved, something as simple as that. And then whatever country that's going to, we have it translated into their native language. And then we put that sticker on the bucket so that when someone receives it, someone from afar thought about them and wrote a love note to them. And there's that kind of love connection. You don't have to know the person, but when you read it, you feel it. And that was kind of like a personal way for people who don't have the opportunity or they don't want to go to the location. They can still have a connection of some sort to the people that they're going to be helping provide clean water to. And so we did that at Vera Bradley with the staff there, and we're able to bring those stickers out. So when we distribute them, those love notes are all on there. And the employees in Fort Wayne, Indiana, were able to connect with the other employees just outside of Phnom Penh, which is kind of cool. And I think they like that too. As personal. I like relationships. And if I can figure any way out to make that connection, I want to do it.
I really love that. Is there anything else that you'd like to tell our audience, anyone listening, about One ATTA Time? How can people get involved?
Yeah, great question. There's a few ways you can get involved. Obviously, one is to learn about what we do. And so that's just simply on our website at oneattatime.org.
Mm-hmm.
It's actually ONEATTATIME.org.
Yeah.
So there's 2 T's in there. It's a little confusing, but it's also called ATTA for short. And yeah, so learning about what we do and how we do it in the global water crisis. A lot of times when we think about the global water crisis, it's more of like an umbrella. And so you have access to water, treatment of water, water sanitation and hygiene, which is about learning about how to properly use your water, and then latrines, which would be bathrooms. And we really just focused on the treatment of water. Most of the places we go to already have access. They need to filter it or treat it somehow. And the way we treat it is through filtration. And the filter that we use takes out 100% of the bacteria and parasites that make kids sick. So what's killing children around the world is due to bacterial infection, parasites, cysts, amoebas, things like that. And so that takes out 100% of it. And the filter will last up to 10 years at least or more.
That's crazy.
And I only know
amazing.
that because we've seen it. So Bryan still uses the same filter that we've given him clean water to.
Wow.
And his mom during COVID was pregnant. And actually, right when they opened the country back up in September of 2020, I flew down there to see him to make sure he was okay. And his mom was in the house and she was like, I come down, but I have COVID. I'm like, stay up there. and she's like, I know. And I'm like, she's like, but I'm pregnant. And I'm like, oh, congratulations. And she's like, I'm having a girl. And I'm like, oh, that's so great. What's her name? And like, her name's Kelsey. And I'm like my wife? And she's like, yeah, you dummy. I was like, no way.
Oh my gosh.
Right?
That is so sweet.
Isn't that awesome? And that for me means the whole world is like, I am so proud of the work that we are doing and the work that we have done in giving so many people clean water. But personally, that moment I realized, my goodness, what an honor that this one family, we share this bond together. It brought us together, and we have this experience for the past 10 years because of dirty water, now clean water. And my wife was able to hold baby Kelsey, and and it's just it's like the best gift ever, and it just gives me so much life. And so in that space, like if you care about water or you feel like I want to be a part of that, reach out to us. You can email us, you go to our website, you contact us. We are pretty dang quick when it comes to response, because in my experience, when I reached out to those other nonprofits and they never contact me back, I'm like, what a bummer. So we try to make sure that, we're able to communicate quickly, which is why you don't email me. That's just because I'm not the best at that. But we have a system set up to where someone, either one of our staff or volunteers, will reach out. And so if you're interested in wanting to learn more and want to talk to us, you can. Obviously, donations is huge and massive. It's $100 to give a family access to clean drinking water for the next 10 years. That is really cheap if you think about it.
Wow.
And that includes all the scientific data, the follow-up, all that stuff. All that's included in that whole package. The same kind of care that we give to that Vera Bradley has done to all those, factory workers is the same kind of care we give to someone who just gave $100. It's all the same. And then following us on social media, you can. We're trying to get our presence up there a little bit more, but we're busy, and social media is something that we're not the best at. But you can follow us on there for information, or our newsletter, but namely our website. Get to know us. I'd like to get to know other people too who are interested, and kind of see where the conversation goes from there. And maybe it's not water. Maybe you're like, you watch this or you heard this podcast and you're like, man, I feel like I'm in this like slump. Reach out to us, and they'll tell me like, hey, this person wants to talk to you about where they're at. And I'm like, nothing gives me more joy than talking to people where I once was, and asking questions and seeing what makes them come alive too. So yeah, that's how you can get connected.
I love
Yeah.
that. Thank you so much for this, Sean. This is such a fun conversation, and I learned so much.
Yeah, you're welcome. My pleasure.
Thank you for listening to this episode. If you'd like to learn more about today's topic and guest, head over to the show notes linked in the description of this episode. There, you can get access to resources, links, and ways you can get involved in the pursuit for global health. And if you loved this episode, don't forget to write me a review on Apple Podcasts and rate the podcast on Spotify. It helps me get in front of more people just like you and continues to elevate the causes we are so passionate about. I'll see you in the next one.